Welcome to this complete masterclass on upper limb anatomy, specifically tailored for nursing officers targeting exams like NORCET. We will cover the entire upper limb, from the shoulder girdle to the fingertips. Our focus areas include osteology, major joints, myology, the brachial plexus, and clinical anatomy, with emphasis on common exam points. Starting with osteology, the clavicle is the only horizontal long bone. It is the first bone to start ossification. The most common site of fracture is the junction of the medial 2/3 and lateral 1/3. The scapula features key landmarks like the glenoid cavity and the acromion process. Clinically, injury to the long thoracic nerve can cause winging of the scapula due to paralysis of the serratus anterior muscle. The humerus has several nerve relationships. A surgical neck fracture often involves the axillary nerve. Crucially, a shaft fracture is strongly linked to radial nerve injury, resulting in wrist drop. In the forearm, the radius is lateral and is the site for the radial pulse. The ulna is medial, with the olecranon process forming the elbow tip. Supination and pronation occur at the radio-ulnar joints. The carpal bones are easily remembered by the mnemonic, "She looks too pretty, try to catch her." The most common carpal bone fracture is the scaphoid, and the most common dislocation is the lunate. Here is a previous year's question. Which nerve is most likely to be injured in a mid-shaft humerus fracture? The answer is C, the radial nerve, which causes wrist drop. The shoulder joint is a ball and socket synovial joint. It is the most mobile but least stable joint. Stabilization comes dynamically from the rotator cuff muscles and statically from the glenoid labrum. The rotator cuff muscles, or sits muscles, stabilize the shoulder. Supraspinatus initiates abduction. Infraspinatus and teres minor perform lateral rotation, and subscapularis performs medial rotation. Which of the following is not a rotator cuff muscle? The correct answer is C, teres major. Remember, the sits mnemonic includes teres minor. The axilla contains the axillary artery, vein, brachial plexus cords, and lymph nodes. Clinically, 75% of breast lymph drains here, which is crucial knowledge for mastectomy care. The brachial plexus originates from C5 to T1, supplying the upper limb. Its structure follows the order: roots, trunks, divisions, cords, and branches. The mnemonic is reach to drink cold beer. The 5 main branches include the musculocutaneous, axillary, radial, median, and ulnar nerves. Each supplies specific muscle groups, such as the radial nerve for extensors and the median nerve for flexors. Erb's palsy is an upper trunk injury, often caused by birth trauma. The characteristic deformity is the policeman's tip hand, where the arm is adducted, medially rotated, and the forearm is extended and pronated. Klumpke's paralysis is a lower trunk injury, affecting C8 and T1. It results in a complete claw hand deformity. Due to T1 involvement, it can also present with Horner's syndrome. Question 3. Policeman's tip deformity is seen in? The answer is B, Erb's palsy, which is a C5 to C6 injury. The radial nerve is the extensor nerve. It supplies all extensors. Injury causes, such as humerus shaft fracture or Saturday night palsy, result in the clinical sign of wrist drop. The median nerve, the laborer's nerve, supplies most forearm flexors. Compression at the wrist causes carpal tunnel syndrome. Clinical signs include ape hand deformity and loss of thumb opposition. The ulnar nerve, or musician's nerve, passes behind the medial epicondyle. Its injury causes claw hand, which involves hyperextension of the MCP joint and flexion of the ring and little finger IP joints. Question 4. Wrist drop is caused by the injury of which nerve? The answer is C, the radial nerve. Carpal tunnel syndrome involves compression of the median nerve at the wrist. Symptoms include tingling in the lateral 3.5 fingers. Diagnostic tests include Phelan's test and Tinel's sign. The arterial supply follows a path from the subclavian artery to the axillary artery, which becomes the brachial artery. The brachial artery divides into the radial and ulnar arteries at the cubital fossa. The brachial pulse is located on the medial aspect of the antecubital fossa. It is clinically important for blood pressure auscultation and pulse checks in infants during CPR. The radial pulse is the most common site for pulse assessment. Allen's test checks collateral circulation via the ulnar artery before ABG sampling. A positive test, flushing within 6 seconds, indicates safety for puncture. The superficial veins include the cephalic, basilic, and median cubital veins. The median cubital vein, connecting the other two in front of the elbow, is the vein of choice for venipuncture. Question 5. Which vein is most commonly used for intravenous injection and blood collection? The answer is C, the median cubital vein. Axillary lymph nodes receive 75% of lymph from the breast. Mastectomy with node clearance carries a significant risk of lymphedema in the arm, a crucial nursing consideration. The cubital fossa is the triangular depression in front of the elbow. Its contents, from medial to lateral, can be remembered as MBBR, median nerve, brachial artery, biceps tendon, and radial nerve. Colles' fracture is a fracture of the distal radius with dorsal displacement, typically caused by falling on an outstretched hand, or fouche. This results in the characteristic dinner fork deformity. Smith's fracture, or reverse Colles', involves ventral or anterior displacement of the distal radius. This is caused by a fall onto a flexed wrist and results in the garden spade deformity. Question 6. Dinner fork deformity is seen in which fracture? The answer is B, Colles' fracture. Compartment syndrome is an emergency complication. Assessment relies on the 5 Ps: pain out of proportion, pallor, paresthesia, pulselessness, and paralysis. Nurses must recognize these signs promptly. Volkmann's ischemic contracture results from untreated compartment syndrome, often following a supracondylar fracture. It leads to muscle necrosis and a permanent flexion contracture of the hand and wrist. A quick question: what is the most common carpal bone to be fractured? The answer is the scaphoid, where tenderness is often found in the anatomical snuff box. The deltoid muscle is innervated by the axillary nerve and functions in arm abduction. The preferred site for IM injection is 2 to 3 finger breadths below the acromion process, with a maximum volume of 1 milliliter. Epicondylitis includes tennis elbow, or lateral epicondylitis, which affects extensors. Golfer's elbow is medial epicondylitis, affecting the forearm flexors. Question 7. The nerve passing behind the medial epicondyle of the humerus, the funny bone, the answer is B, the ulnar nerve. Post-mastectomy care aims to prevent lymphedema. Critical nursing alerts include avoiding blood pressure measurements, IVs, or blood draws on the affected arm. Arm elevation also promotes drainage. In this case study, a patient with a mid-shaft humerus fracture cannot extend his wrist. This suggests a radial nerve injury. Nursing actions involve documentation, splinting, and neurovascular checks. Now, let's look at another previous year's question. Before performing an arterial blood gas analysis from the radial artery, which test is performed? The correct answer is B, Allen's test. This test assesses the collateral circulation provided by the ulnar artery to ensure the hand is safe for radial artery puncture. Let's review the golden points. Remember that the clavicle is the first bone to ossify and is the most common site of fracture. Tenderness in the anatomical snuff box suggests a scaphoid fracture. Also, the lunate is the most frequently dislocated carpal bone. A fracture of the surgical neck of the humerus puts the axillary nerve at risk. Thank you for watching this video. The references used include B.D. Chareja's Human Anatomy, Ross and Wilson Anatomy and Physiology, and previous year question papers.